Hi everyone. Welcome back to Grace on Telehealth, a channel where we focus on health issues. Today, I am here to talk about diabetes. I am moved by a lot of questions and having noticed very high rate of unawareness concerning diabetes. A lot of people say, oh, I'm borderline, I'm not diabetic. Others say, oh, I don't want to take medicine. I want to try natural options. And some say, I don't have any symptoms, so why do I have to bother? The doctors and nurses, they just like to give people medications. And a lot of people are in denial. They don't want to agree they have diabetes. So the question is diabetes really a serious condition? The question is, can diabetes really lead to death? Another question is, can diabetes put someone in a position where he or she cannot be able to take care of him or herself? Another question is, how dangerous is diabetes? So I want to create a curious situation within us to ask ourselves this question. Do I have diabetes? What is diabetes? And for people that have diabetes, what can I do to manage it better? Because you have diabetes, it just stays with you. Self-management is the best treatment to diabetes. So that is what I'm here to talk about. This is Dr. Victoria Ngozi Ogbuji. Welcome to Grace on Telehealth. So in this section, I'm going to take it bit by bit. I'm going to give general overview about diabetes. Then I will handle the different types of diabetes because we have type 1, type 2, gestational, pre-diabetic. And then how do we screen for diabetes? That is the hemoglobin A1C. They will be treated individually. So right now, what is diabetes? If you know what is diabetes, can you please put it down in the comment section? Because we need to know some of these common conditions that is really causing a lot of comorbidities in our society. We need to know what they are so that we can take care of it. Remember, living a life at equilibrium means knowing your health, knowing your environment, knowing yourself, knowing your body. And one of it is knowing if you are diabetic. Research shows that diabetes is a disease that occurs when your blood glucose, which commonly is known as blood sugar, is too high, period. That is diabetes. So if you look at the picture above, you will see like a blood vessel and you see the yellow spots in a normal blood vessel. That's a normal blood vessel that has normal glucose level, just a few. And the other one that has high glucose level, you see the spots all over? That tells you that there is a problem. So when you're looking at both of them virtually, you will see that there is a big difference between the normal and the abnormal. The blood of a person that does not have diabetes and the blood of somebody that has diabetes are not the same. Remember, this is blood glucose. So when you hear blood, it means it is in the blood. And remember, the blood controls the body, runs from head to toe. So anything that affects the body, the blood must be taken very seriously. It's not like you have a fracture of the finger, then only this finger is affected. You can just cut off this finger and that's it. Or you have a scar in the face. You can do plastic surgery, just localized. No, diabetes is not localized. It is generalized. It affects your whole body. I mean, from head to toe. That is why you must take it very, very seriously. Okay? One may ask, what is the duty of glucose to the body? Why are we concerned about glucose if it's high or low? Remember, glucose is the main source of energy in your body. And how do you get glucose? By food intake. When you eat, most of what we eat, mostly carbohydrates, have glucose in them. So when you talk about energy, you're talking about glucose. Your body can also make its own glucose. So how are we concerned about glucose? How does it affect the body? Glucose can be high, it can be low. When it's high, you see, I will talk about it when I get into details about diabetes. It can be high, it can be low. When it's low, person can pass out and go into unconsciousness. And you just see somebody just slept and didn't wake up again, and it could be that the blood sugar drops so bad. That's why if you have somebody that is diabetic, please pay attention. If you take insulin or diabetic medications, pay attention. Try to know the signs of hypoglycemia. That's what it's called when the sugar is low. And hyperglycemia is when it's high. And in that case, there are some other symptoms too. I'll mention those symptoms when I start talking about different types of diabetes. Okay, what really causes diabetes? Is when the body is not able to metabolize the glucose normally. There are some organs that help in the metabolism of glucose. The pancreas that produces a hormone known as insulin. That's why some people take insulin. That means the pancreas is not making enough insulin to metabolize glucose to absorbable phase where they can be absorbed into the bloodstream and to other tissues of the body. Okay, the pancreas makes the insulin. So when there's an abnormal function of the pancreas, it can't make enough insulin. At some point, it can't even make insulin at all. At some point, it makes, but it's not enough. So when such happens, the body can't function, reduce energy because the tissues are not getting enough energy, enough glucose. So if you have diabetes, period, your body is not making enough insulin or having a good metabolism of the glucose. So when such happens, what happens? If there is, like the picture I showed earlier, if there's a lot of glucose and it's not metabolized, it's just flowing in the body, in the blood, and you have a lot of it. It becomes hyperglycemic. So what are the risks of diabetes? Remember, I told you it flows in the blood, so it goes from the head to toe. And then when it's, the nerves have certain tolerable glucose level. When it's above that level, what happens? I'm trying to make this video so that anyone that hears it, that watches it, will understand. Okay, so it's like you soaking tissue. Let me take tissue in a water or in oil. Let's assume that the nerves are just like tissue, and you soak them in water. What will happen? It will keep absorbing it. But for nerves, they have certain standard of glucose that is normal. It's like help them work at a homeostatic level. So when it's too much, they will just start to deteriorate. So when the nerves start to deteriorate, mind you can't get it back. And the nerves are in the eye. That's why some people that have diabetes eventually become blind, because they develop what we condition called retinopathy. That means the nerves in the eyes have been affected. And some people, if it's not caught early, to start giving some, treatment, some injections into the eye, they eventually lose the eye due to the complication of diabetes caused by diabetic retinopathy. Even the feet, at the time, the feet becomes numb. And, some people feel like even when you touch them on the sole of the feet, they don't feel it because it is called neuropathy, diabetic neuropathy. And in that case, it's very dangerous. So you may step on a nail, the nail will stay in your feet, you don't even feel it. You may step on broken bottle, you will stay on your feet and you will not know. And eventually it becomes sore, and that's how you see some people develop diabetic sores and then diabetic neuropathy, and eventually they lose part of their legs. Okay, so it's a very serious condition. So I want us to really take our time to check if we are diabetic. The best management is preventive. Another management is finding out early that we have diabetes so that we can start taking care of it. Okay, that takes me to your annual screening. When you go for your annual screening, please ask the doctor to check your hemoglobin A1C. I will talk about that later in another video. But I urge every adult to know their hemoglobin A1C, whether you're diabetic or not. So that is the best step to prevent diabetes. This is Dr. Victoria Ngozi Ogbuji. If you have been following me wonderfully, I really appreciate your support. This is Grace on Telehealth. Thank you for viewing. See you in my next video. Thank you and God bless you. Did you enjoy what you just watched? Then subscribe to my channel and share this video, because you never know who might benefit from it. I'll be dropping health updates every Wednesdays and Saturdays. So don't miss any. See you next time. Cheers.